Good morning, everyone. The pleasure is mine. My name is Reginald F.A. Thomas, the Deputy Chairman of CROSS, the Committee for Caribbean Research and Social Security. I want to welcome all of the attendees to this second webinar, where we will be discussing and diving deep into when the climate shifts, who pays, the common strain on social security systems. And so for my introductory remarks today, I would like to propose 4 hours as it relates to the topic and the importance and the significance of social protection and social security. The first hour is responsibility. What responsibility do we have to ensure that the tripartite relationship takes account of all of the emerging issues and challenges which can impact social security? So if we execute our responsibility, then we enhance our reliability, because social security ought to and must be reliable, because it's supposed to protect and safeguard quality of life and dignity, and to prevent older persons from falling into poverty. So when we enhance our responsibility and we heighten our reliability, then our responsiveness is key. And what we are doing here today is really to start and to signal that CROSS is really ensuring that in the Caribbean, social security institutions have a high level of responsiveness given the emerging issues and challenges. So the emerging issues and challenges, really, one of the key areas is that of climate change. In St. Vincent and the Grenadines, we had Beryl and we had Lasso Freya, and we still seeing the impact of that on the quality of life and the expansion and the challenges that those issues presented for the economic sector. And when the economic sectors are impacted, then the dependency ratio and the dependency burden of social security institutions are also impacted, because participation drops. And if participation drops, then the level of wage and or salary or take-home income also drops. So we must represent ourselves, which is the fourth hour. We must represent ourselves in a full and complete way, because when you look at ILO Convention 102 and what that Convention 202 and Convention 128 and what those are really seeking to provide for us, we at CROSS, we within social security institutions, we at the central bank, because we have the governor of the Eastern Caribbean Central Bank, the deputy governor here, Father Henry, we have to really make sure that our representation is full and complete. I mentioned earlier on the role of the tripartite entity, how it is that we enhance the relationships and strengthen the commitment for the continual enhancement of social security. And when we do, what do we expect the results to be? I think when we do heighten our representation, then our responsiveness then becomes much more quicker. ILO says that pension should be increased every 3 years net of inflation. Mr. Thompson can do the maths and tell us, which countries in the Caribbean are in the position to increase old age pension every 3 years. And how does that link to the quality of life and the cost of living? And do we have a responsibility to ensure that these conventions from the ILO are not just conventions, but a part of the reliable system of social security, which in many of these countries, 85% of the people of the country, that's the only thing they have for their retirement. They have nothing else. And then when we couple that with the cost of healthcare, the cost of living, what are we seeing about the quality of life of older persons in the region and the dependency that they started out with in their working career with Social Security? So today, as we meet in the second CROSS seminar, Those are my critical concerns. And the topic that we are addressing, when the climate shift, who pays? All of us. And the coming stress on Social Security. I don't think it's coming. I think it's already here. And I think what part of the stuff that we have to start to do is to then do deeper impact, deeper research, so that we have a full and complete representation of all of the data sets that will allow for enhanced responsiveness, responsibility, and reliability. So I welcome all of us today to this session. All of us in the region are noticing the heat wave, the floods in Trinidad and Tobago, and so many of the other things that are happening in our region. And when those things happen, businesses are impacted, workflow and contribution rates, and so are also impacted within Social Security. So today, my role is to greet you and to welcome you, and then to say to who is the chairperson for our session today. The chairperson for our session today is a brother of mine. I call him David. He and I have another brother who was in Social Security since kids, but he's now retired. And we have really indicated that we have to start to take relaxation more, and then we're going to go somewhere around the world on a cruise. But today, the chairperson for this session, the moderator, is Mr. David A. Matthias. He is a career civil servant for over 30 years, experience in management at the middle to the senior level throughout the civil service of Antigua and Barbuda. He received his BSc Economic and History from the University of the West Indies, Cave Hill campus, and his MSc Development and Project Planning from the University of Bradford, United Kingdom, before eventually becoming the Budget Director, Ministry of Finance, Antigua and Barbuda in 2002. After his 7-year career as the Budget Director, Mr. Matthias accepted the post of Executive Director of the Antigua and Barbuda Social Security System in 2009. In addition to his formal education, Mr. Matthias has participated in several professional development courses, notably project management and appraisal, conducted by the Caribbean Development Bank, strategic planning for public sector management, ILO, and Turing, and performance budgeting and other modern budgeting tools, the IMF Institute in Washington. He's a fellow of the James A. Baker III Institute for Public Policy, Rice University, as a contributor to the annual American Project in 2002. The political consequences of economic turmoil in Latin America. He's currently an adjunct lecturer at the University of the West Indies, Five Island campus in economics. Mr. Matthias serves as the president of the American Commission of Organizations and Administrative System, CAUSA, of the Inter-American Conference on Social Security, head office in Mexico. Also, he has made contribution to digital agenda for the conference, and it's redefining the role of CAUSA. So the pleasure is mine. Pass the ball and the baton over to today's moderator, Mr. David Matthias.
Okay. I am not Mr. Matthias. He has sent some apologies that he will join us. He has sent some apologies and he will be joining us later. So I would have the pleasure of introducing the first. I am Patricia Edwards Westcott, a member of the HU Center for Health Economics, a member of the CCROSS Secretariat, and I will have the pleasure of introducing the first presenter for this morning. That is Ms. Shahara Razavi, and she is the director of the Universal Social Protection Department at the International Labour Organization. Prior to joining the ILO, she was chief of the research and data section at the UN Women, where she directed the research for the entity's major flagship reports. oversaw the Gender Statistics Program, and provided technical support to intergovernmental negotiations. She was senior researcher at the United Nations Research Institute for Social Development, where she coordinated cross-country comparative research programs at the interface of social policy, social protection, labor markets, and the care economy. Ms. Razavi obtained a BSc from the London School of Economics and Political Science, and an MSc and a PhD from Oxford University. She has published extensively in social policy, social protection, gender, and work in the development context. It's my pleasure now to introduce to you Ms. Razavi. So, Ms. Razavi, you can proceed.
Yes, good morning. And thank you very much, Ms. Edwards, for your kind introduction. And it was also a pleasure to hear Mr. Thomas, and an honor for me to be joining this distinguished panel. I will, if you allow me, I would now like to go to the presentation, full presentation. Please let me know if you can see the screen.
Yes, we're seeing the screen.
Okay, very good. So let me begin by just saying that, as I said, the topic of this webinar is obviously extremely timely about the climate shifts happening and who's going to pay for it, and what does that strain imply for social security systems. I will be drawing on the ILO World Social Protection Report 2024-2026, which was exactly focused on this topic of universal social protection for climate action and a just transition. So I will start by saying a few words and sharing a few slides on the way in which the life cycle risks and climate risks are coinciding. As Mr. Thomas already said, the climate crisis is here. It's not in the future, it's already here. So after that, I'm going to present some data to you in terms of where we're at globally in terms of social protection coverage. And we will see a lot of the inequalities and diversities across the world. And then really asking the question that what is standing in the way of extending social protection and making it truly universal as well as adequate and comprehensive, what some of the barriers are. And I will end with a few slides on the whole question of financing, which is obviously a very important topic for this webinar as well. Because we're asking who's going to pay for it. So the whole issue of financing of social protection becomes very important in this context. So first, let me begin with saying a few words about the multiple risks that we all face across the life cycle. And here in the center of this first figure, what you can see is the ordinary life cycle risks, that like sickness and loss of a job, getting old, for which we need all the 9 branches of social protection. But what we also see here is that climate change and climate policies have adverse consequences for jobs and incomes and health and enterprises. And therefore, on the left of the figure, what you see is the way in which the climate crisis, extreme events, as well as slow onset changes are going to impact the ordinary life cycle risks for which social security institutions have been kind of designed to address. But when we have things like increased disease burden or the kind of disruptions that come with whether it's floods or droughts in many parts of the world, this reinforces and exacerbates and accentuates the life cycle risks. And therefore the need for social security systems to respond, and to respond in a very, as we said, as Mr. Thomas pointed out, to really be responsive to these risks and be able to kick into action automatically. Also, what we can see is that to the right of this diagram, what we have are the way in which many of the climate-related policies that are being put in place and which are urgent, and we need to have those policies, for example, closing down some of the polluting industries and sectors, will have certain both intended and unintended consequences. For example, when we close polluting industries, there's a need for job restructuring. Workers need to have that income security to reskill and shift to emerging sectors where new jobs are to be found, because this shift doesn't happen automatic. Workers need income security to reskill, retool themselves, and to make the move. Also, many of the policies that are put in place, for example, will lead for climate action, will lead to increase in the price of energy, price of food items, which will require additional support through social protection system to offset the increasing costs, so that people are not confronted with the kind of rising cost of living, which will really reduce their well-being and income security. So very importantly, what this says is that we need to really be thinking about ordinary life cycle risks that social security systems have been designed to respond to. And now these climate-related shocks and the way in which these two things are coming together to reinforce each other. And therefore, for social security and social protection to be able to really be part of the solution to these multiple risks that people are facing. And yet, when we read the IPCC reports, for example, social protection remains merely a footnote, when in fact we think social protection can help realize climate policies. And we know through history, when countries have had to make big transitions and transformations, the shift from agriculture to industry, the recovery from world wars and disruptions and displacements, welfare systems and social security systems have been incredibly important in creating that kind of social peace and prosperity. And therefore, it was only to be expected that in this kind of big transformation that the climate crisis entails, we also need to have strengthened social security systems to hold our economies and societies together and make it possible. When we look at adaptation, what in the climate literature, climate jargon, there's a lot of talk about adaptation and mitigation. Adaptation, social protection has an important role to play here in being able to tackle the root causes of vulnerability by preventing poverty and reducing inequality. In doing so, it kind of enhances the capacities that people have to cope with climate-related shocks by strengthening those capacities ex ante, by providing a basic income floor and access to healthcare. So when the shock comes, they're better placed to withstand the shock. And also by reducing vulnerability ex ante, people are in a better state to be able to hold their income and their well-being together when the shock strikes. It also contributes to their adaptive capacities through positive impacts on human development, on productive investment, and livelihood diversification. And then when we think about mitigation, mitigation is about stopping the drivers of climate change by keeping fossil fuels in the ground. So what's the role of social protection there? Now, the first thing is that social protection systems are key to compensating and cushioning people and enterprises from the potential adverse impacts of mitigation and other environmental policies. I talked about, the closing of brown sectors and the loss of livelihoods and jobs around mines, so it's not only the miners, it's also the whole livelihood system around mines, for example, and how we need social protection systems together with active labor market policies to help people make that transition in their jobs and their livelihoods. Social protection can also directly support mitigation efforts. For example, when we reduce fossil fuel subsidies, some of those savings can be diverted to building and enhancing the adequacy of social protection benefits to be able to help people cope with the price increases that come with the change in energy prices, for example. And then pension funds can also have a direct impact by the greening of pension funds and where they're being invested. So these are just some examples, and we go through them in some detail in our report. But then this is all well and good, but where are we in the world in terms of being able to provide that kind of coverage that we need? Now, the good news is we have, for the latest data that we have in the World Social in the World Social Protection Database, which collects data from around the world, from all the countries through the administrative data sources, what we can see is that we have made an important progress in being able to now say more than half of the world's population has access to at least one social protection benefit. This is not talking about a comprehensive system with the whole life cycle risks that we say, but at least one social protection benefit. So we are at 52.4% compared to 42.8% in 2015. Good progress, and yet what we also know is that this still leaves about 3.8 billion people around the world with absolutely no social protection to fall back on when they have the need for it. And when you look at the regional diversities, and we have the figures at the bottom of the figure on your left, you will see some regions, for example, in Africa, even with some progress in 2023, it's not even reaching 20% coverage of social protection with at least one social protection benefit. We have much higher rates, as you can see, in other parts of the world, particularly Europe and Central Asia. And when we look at the different branches of Social Security, there again, there's quite a big significant differences there. Pensions were mentioned already by Mr. Thomas. That's the kind of benefit for which we have some of the most extensive coverage rates around the world. Around a little under 80% of people above retirement age have access to a pension. Big question mark about whether it's adequate or not. That's we have data in the report that shows that in many countries it's not adequate because it's not keeping up with the cost of living and inflation. But at least there is that basic coverage for about 20%, 80% of the population who needs access to a pension and has the entitlement for it. But when you look at other benefits, look at unemployment benefits, actually, the average for the world, 1 in 5 unemployed workers will have access to unemployment benefit. And when we look across regions, that rate tends to be very low, particularly in developing countries. But most worryingly, when we look at countries that are at the forefront of the climate crisis, that's where, ironically, we have some of the lowest coverage rates. So here in this map, what you see is that the 20 most vulnerable countries to climate change, the ones that are really at the forefront of the climate crisis, only achieve just about 9% coverage of their population, which is way below the global average of 52.4%. And if we increase the number of countries to the 50 most vulnerable countries, we only reach about a quarter of the population being covered. So these countries are really not prepared for the climate crisis, and a lot more needs to be done in terms of extending social protection. And here I just thought it would be good to show some figures for the SIDS, which are many of them very much at the forefront of the climate crisis. And yet, as you will see, the coverage rates are not very high. For SIDS, it's only about 43.5% coverage in 2024, which is below the global average. For CARICOM countries, also way below the global average. Also, interestingly, if you look at countries with what are high-income countries, again, there is diversity. So high income level does not always translate into high coverage. And you can see the difference between, say, Guyana and Singapore on the one hand, which have a kind of 100% basic coverage, versus Trinidad and Tobago that only reaches a little more than 57.2%. So a lot more needs to be done there. Now, what are some of the key challenges in extending coverage? I want to really address this issue of all workers needing access to Social Security. And we are not there yet. There are many barriers that stand in the way. Legal provisions are not preparing for example, extension of Social Security to people who are self-employed, to workers who are self-employed. There are administrative barriers. There's barriers in terms of contributory capacity, having a known employer who can contribute, and if not, having state subsidies to substitute, to really be able to complement the contributions of self-employed workers. But what we also see is across middle and low income countries, not all countries are incapable of covering self-employed workers. Some are doing better in terms of providing self-employed workers with social security coverage. You will notice a country like Brazil and Turkey, for example, doing relatively better in terms of providing coverage for self-employed workers. And this is something which I think needs to be obviously top of mind for social security institutions, how to extend coverage to all workers, and particularly beginning with those who have some contributory capacity and then extending it further. I'm going to say only a few words about social health protection, where we still have almost 2/3 of the global population being protected by a social health protection scheme. Unfortunately, progress has stalled. Even though we had the COVID pandemic, which should have been a wake-up call. And there are many pronounced regional coverage gaps that you will see. I don't have time to go into the details, but I'm sure Dr. Harewood will go into some of the barriers in terms of still having very high out-of-pocket payments, even where people are legally covered and even have coverage through social health protection schemes, issues around physical distance, availability and acceptability of health services, having sufficient health personnel and so forth to really make that right to healthcare a reality. So a very important area of work in the context of the climate crisis, which we know is reinforcing the need for social health protection, for good access to healthcare without financial hardship, and also for sickness benefits. So these are important areas of social protection. And then there's a big issue around gender equality and the way in which the climate crisis we know is an inequality multiplier. And in many rural, particularly, and remote areas where there's not adequate infrastructure, the time needed to procure the basic necessities of life, whether it's drinking water, fuel, wood, and so forth, all of this work is going to intensify. The time and the energy needed to procure those basic necessities is going to increase in the context of the climate change and climate crisis that we have, and much of that burden will fall on the shoulders of women and girls, with negative implications for their own health and well-being, as well as their schooling rates, their ability to access decent employment, and so forth. But let me say a few words about financing, given the topic of our webinar today. Social protection expenditure we do see is inadequate in many, I would say, in a large part, if not across countries, regardless of their income level. But there is also a lot of diversity across different income levels. What you can see here is that high-income countries are spending about 25% of GDP on social security, including social health protection. But then we see much lower levels of expenditure in middle-income and low-income countries, being very, very low at 2% of GDP only. So a lot more needs to be done in terms of creating that fiscal space and increasing social protection expenditure. And this is only going to get heavier when we also take into account the kind of climate crises that countries will be facing. And we've done some calculations in terms of the financing gap for social protection, for having that minimum floor for the population. And our calculations show that for low and middle income countries, we need an additional investment of 3.3% of GDP in order to have that basic social protection floor. And the financing gap, of course, varies across regions. In Africa, where you have the greatest coverage gaps, you also have obviously the biggest financing gap and need for additional investment. And here, maybe a figure that would speak to the region about underinvestment in social protection in the SIDS, for example, data that we have here, you will see that compared to the global average, both in terms of healthcare and in terms of the income security, the income-related branches of social security, expenditure levels in SIDS is much lower than the global average. And of course, the needs are much higher. But this is the last slide, and I know that I'm probably out of time, but I think there's an important issue around kind of justice here. what this graph, what this figure kind of shows is the relationship between a country's vulnerability score to climate change and social protection coverage. So at the bottom on the horizontal axis, you have percentage of people that is covered, with many high-income countries covering, you know, close to 100% or near there of their population, and many low-income countries and climate vulnerable countries being at the lower end in terms of coverage rates. But on the vertical axis, you have the vulnerability score. And here we have the combination of the greatest vulnerability to climate crisis and lowest coverage rates, but also the size of these bubbles show the contribution to greenhouse gas emissions. So the injustice, there's a double injustice here with those countries that have contributed the least to the global greenhouse gas emissions, also now being at the forefront of a climate crisis that caused by the historical and ongoing greenhouse gas emissions of some of the high-income countries who managed to develop, but at the same time contributed to the climate crisis that now falls very much on those who have the least capacity to cope, the lowest coverage rates, and the greatest fiscal constraints in terms of being able to extend social security coverage. So there needs to be some element of global justice as well. We can leave that for the discussion, what is happening in terms of financing and whether we do have that solidarity in financing that ILO Convention 102, Recommendation 202, and many other social security conventions speak about. And I will leave you with this in terms of what are the strategies to close the financing gap. We have, of course, domestic resource mobilization that needs to be enhanced. And this is the lifeline of all social security systems, combination of progressive taxation, social security contributions, but also very importantly, we need to have a better global financial architecture that can facilitate resource mobilization, particularly of developing countries, by helping them to eliminate illicit financial flows, allowing them to recoup taxation from multinational corporations, have better management of debt, a big issue that was discussed in the Financing for Development conference, and the need for contingency financing. I know there's some important regional initiatives in the Caribbean, but there is also a need for global solidarity and a much more enabling global financial architecture. So thank you for your indulgence in listening to a rather long presentation, and I want to leave it here and look forward to hearing the other panelists and our discussion. Thank you.
Good morning, colleagues, and good morning, and thank you very much, Dr. Risavi. My apologies for my tardy arrival. I seem to be myself subject to the vicissitudes of climate change, in that Antigua being a very water scarce country, when water is available, one does have to avail itself to executing your household functions. So my apologies for my tardiness this morning. It really could not have been helped. I operated on the wrong timeline. All right. With that, I do hope that my dear friend and brother has done an able job of saying who I am and who. But in case he has not, my name is David Mathias, the moderator or the chairperson for this morning's discussion. But I know that I would have been ably represented by Mr. Thomas. And I do have to thank you, Patricia, for starting the session this morning. It is my task now to simply introduce Dr. Heather Haywood. She's a lecturer in public health and epidemiology, the coordinator is the coordinator of the Master of Health, EMBA Health Care Management, and UWI PAHO Postgraduate Diploma in Health Policy and Health System Programs at UWI Cave Hill Campus, Barbados. Her current contributions build upon her clinical and public health training and previous experience as a medical officer of health, Ministry of Health, Barbados, with overall administrative responsibility for the delivery of public health and primary care services to a geographically defined catchment. Further to her membership in the UWI Cave Hill COVID-19 Public Health Group, Government of Barbados COVID-19 Health Advocates Team, and the American Public Health Association, she collaborates with the Health Education Unit Center of Health Economics and Global Burden of Disease Institute of Health Metrics and Evaluation. Dr. Haywood is the SIDS regional lead for the working group on economic and finance for the Lancet Countdown on Health and Climate Change. Handing it over to you, Dr. Haywood.
Thank you very much, Mr. Matthias, and good morning to everyone. Just putting up my slides. And just confirming that you can see the slides and hear me well.
Yes, we can.
Okay, thank you so much. So today I want to explore the intersection of climate change and social protection, bringing as far as possible a Caribbean health perspective. I'll be drawing on some work we did with the Lancet Regional Countdown for SIDS, and where possible, incorporating the Caribbean perspective. So we want to look at health, healthcare, and how this might interface with the need for increased social protection and in building resilience in our social security systems. So I'll just do a few key definitions and concepts at the beginning related to climate change and to social protection, just to set the stage. And then I will go on to discuss the health implications of climate change and health for social protection, and looking at the reasons why this is important from the context of the vulnerable Caribbean small island developing state perspective. Because we know that if you think about the SIDS lens, SIDS countries by definition are small nations. They're at the forefront of the climate crisis, and you would have heard in the previous presentation, not contributing as much, but barely being affected in a negative way disproportionately by the onset and the impacts of climate change. And we know this heightened vulnerability is linked to our geographical location. Often countries are within the so-called hurricane belts. Globally, the topography is low-lying, some are below sea level, and then small open economies make us vulnerable to economic shocks. And we would have heard that there's also limited capacity to even make the contributions that are required for sustainable, for responsible and responsive social protection system. So these are some of the challenges that we are aware of, and I will interpose then the health overlay on that. And at the end, we'll just look at gaps, some next steps, and some opportunities as we move forward. So we know that the current conversations around climate change really link to contemporary climate change, which is really where our climate has changed beyond natural variability. And we know it's primarily because of anthropogenic acceleration of greenhouse gas emissions and global warming. There are a number of factors that are pointed to, including fossil fuel consumption, development, intensive farming practices, for example, but also healthcare production. So even as health sectors or the health system works to mitigate or to treat people who may be affected by some of the ravages of climate change, we also need to think about responsive and responsible practices within the healthcare system as well, and how we deliver services in a way that will reduce our carbon footprint. With respect to social protection, I want to focus on the whole idea of the social assistance and social insurance, just to have that as the idea of really bringing about the social security systems, because this is where people get benefits paid out to them to assist them, and we know that it is important. So I'm just quoting from the ILO. So we had our colleague from ILO here, but we know that these are benefits to individuals that are based on risks that they will face throughout the life course. And I found this very interesting because even from a health perspective, we think of risks which people face from preconception all the way through the life course. And if you just reflect on it for a few moments, you can think about maternity benefits, which has implications for mother and newborn babies, for family health. We think about sickness benefits, disability benefits, and so forth. And then for people who might be in socially vulnerable situations, low socioeconomic status, social assistance allows people to engage in their communities in a way that allows them to exercise their human rights and the dignity that we all deserve to have as human beings. So we know that health is a resource for life, and we're arguing that if climate change is impairing people's ability for health, it will, by extension, increase the need for social protections. It will, by extension, require people to be drawing on a service that ought to be there to act as a social protective network, a social blanket, whatever term you want to use. But the whole idea is that climate change is driving health in a way where people are going to be making more demands on healthcare. And by extension, there'll be more demands on social security assistance because more people are becoming ill. Some people are becoming disabled as a result of the impacts of climate change. So I want to just explore this a little bit from the perspective of the Lancet Countdown. And I'm grateful to the colleagues who were able to contribute to this. So this next slide just summarizes some of the drivers and pathways for climate change and health. And as you can see, there are multiple pathways that link the nexus between climate change and health. And I just want to be able to focus on the health effects, which is the last box on the right. And I'm going to pick 3 things because of the time constraints for today. But I want to explore how temperature-related illness and death is impacting small island developing states and the Caribbean as well. We'll look a bit at vector-borne diseases and a bit on food and water shortages, some of which came up in the previous presentation. So it is just bringing home to us that climate really impacts our lives and our livelihoods. And I know in recent times, we would have thought about that in the context of COVID-19, which was an acute episode, which was an acute and unheralded episode in our lives and caused a lot of disruption. But climate change does have the capacity to impose similar constraints on our health and well-being and will increase the need for social security. And therefore, we need to think about how to make our social security systems robust enough to respond to that increased need that climate change will be imposing. So as mentioned, I'm going to refer to the 2024 Small Island Developing States Report of the Lancet Countdown on Health and Climate Change. And this report included summaries on 25 indicators from 5 working groups. So I will refer to a few of these indicators as we go through. So the first thing I want to speak about is health and heat. And this came through as a conversation in the first presentation. Heat is causing a problem. And we have been noticing record-breaking heat exposure. And why infants and older adults are being highlighted here is that we need to think about who are the vulnerable people in society and who might be the most vulnerable groups when we think about particular hazards that are linked to climate change. And we noted that looking between 2000 and 2024, 2023, when the report was being prepared, that in 2023, you note a sharp increase in the number of heat wave days. And it was noted that a record average of 41 and 43 heat wave days were experienced by each infant and older adult, respectively, across SIDS. I think most of us do appreciate the fact that the days are hotter. And this exposure was actually 48 and 36 times as many heat wave days as was experienced between 2000 and 2004. So that has a rapid increase. And even though people speak about biological adaptation to heat, we know that there's an upper limit beyond which our bodies do not adapt. And why older people and infants are more at risk because their thermoregulation mechanisms are not as developed, and they therefore are more stressed. Their bodies are more stressed by heat. And certainly for many older adults, they also have concomitant non-communicable diseases, such as hypertension, cardiovascular disease. And these conditions are actually worsened in the presence of excessive heat. So there are a number of factors which would make these 2 groups in particular at risk, but we recognize that the risk runs across the population. So all of us, whether or not we're at the extremes of the age spectrum, will be under, would be under increased risk for health events that can affect our bodies. And I'll go into the health events a little bit more because of the extreme heat. So these are things that are very concerning that emerge from some of the work done for the Lancet. So if you go on to look at heat and physical activity, and I know for many people, when you think about it, it is too hot to exercise, it's too hot to even do work. So we note that over the period 1990 to 2023, there was an ongoing increase in the amount of heat and the fact that hours were being affected by heat. So we actually are losing out in terms of what we're able to be doing in terms of our productivity because of heat. This has implications for work. And when we think about the work that drives our sectors, agriculture, construction, tourism, these are jobs which are done most often in the open air. which often then would be attributing exposure to excessive heat for our workers. If we think about the fact that for many people, hotel work or tourism work can be seasonal, because we know there's a high season, there's a low season in tourism. And if people are not able to work as they ought to in the high season, when they're looking then to be able to make contributions that they can draw upon during the low season, reduced work means reduced contributions, which means that there'll be a smaller pool for them to draw upon in the low season when they would need that to tide them over. And there was a discussion about how employment and lack of employment, has implications for our social security system. So these are things that are important. If we wanted to go to another aspect of health, when persons are being advised how to manage their non-communicable diseases, so hypertension, diabetes, people who are obese, we say to people, you need to exercise, you need to engage in physical activity. We're saying to children, part of the management of being overweight and obese in childhood requires some sort of physical activity. And we can see how being exposed to excessive heat to the point where it reduces the capacity to be able to engage safely in outdoor activity, this has implications also for the extent to which people can manage their chronic diseases, the extent to which children can develop and continue to practice healthy lifestyles by increasing their physical activity. And ironically, the heat also, in and of itself, does cause an increased risk or a worsening or exacerbation of underlying health conditions. So heat worsens the cardiovascular outcomes, strokes, respiratory system, and one of the ways in which the heat also affects the cardiovascular respiratory system and so forth, and even diabetes. This link is actually now being demonstrated is by the potentiation of particulate matter within the environment. So we see that there are a number of factors that are linked to climate change and to health, and this ill health will, by extension, result in more use of the health services, but it means more people may be on sick leave, or more people may require some sort of disability benefit. So we can see where the interlinkages are starting to come through. If we look a bit more in terms of the change in labor capacity, we do have some data now that we can drill down to the Caribbean in particular. We notice, as I would have mentioned, the whole importance of agriculture and construction within the Caribbean. And this looks at the losses in the service sectors. So agriculture, with respect to, if you're comparing 1991 to 2000 versus 2014 to 2023, we do see that there were many more work hours lost in agriculture and construction as a result of heat. So heat is a problem, not just because it makes us uncomfortable. As I said, it potentiates the non-communicable diseases, but it also increases people's ability to be vulnerable to requiring social protection because they're not able to work as well as or efficiently as they should. Some of the concerns that have been generated include, what do you do to mitigate this within the workplace? Because it requires people to invest in the adaptation measures, such as cooling, whether it's fans, whether it's air conditioning units. Is it that you're going to have reduced hours? And these have implications for expenditure by the workplaces. And how does this then manifest in terms of, being able to pay wages? If people work reduced hours, what does that mean for their take-home pay? And ultimately the contributions that they will be making towards their social protection networks. So these are some of the concerns that we're noticing as well. And if we look at the heat-related mortality, the Caribbean really experienced quite an increase. Approximately 3,000 deaths were potentially attributable to heat in the Caribbean between the periods 2009 compared to the periods 2013 to 2022. So this is a major problem. And it does say potential heat attributable deaths, because we still have to refine the ways of measuring and linking these deaths directly to heat. But it is noted that in times of peak heat elevations, that certain increases occur, whether it's from cardiovascular disease, strokes, and so forth. So this is something that is very important to us because this has implications for our workforce. We spoke about the dependency ratio. we need to look at the factors that will inhibit or limit the ability for the contributions that are necessary to keep our social protection as afloat as it ought to be. So heat is a problem. And this is a final slide that looks at the economic losses due to heat-related mortality. So this is just providing, several snapshots which can be simply summed up in the fact that excessive heat causes problems. It contributes to potentially excess mortality. And if you put it in terms of economic costs, we can say that there's a rate of $20 million US lost per year to deadly heat within SIDS. Unfortunately, we didn't have the data to break it down to the individual Caribbean, but I think this just paints a picture where across SIDS, we are very vulnerable from the direct health impacts, so cardiovascular disease, stroke, respiratory disease, but we're also looking at the indirect health impacts whereby there's lost productivity. There are people who will require disability and medical certification, and so that kind of social protection during those times of ill health. And as we continue, we can also look at the infectious diseases. And of concern is the whole idea of the vector-borne diseases. Within the Caribbean, we're not in the stage in the Caribbean where dengue is always with us. It is considered endemic, so there's always this baseline low level of dengue fever. But what has been observed is that heat potentiates the capacity of the mosquito to be a vector. So there's an increase in what we would call vectorial capacity. So not only do the mosquitoes emerge earlier after eggs have been laid, they actually have been found to feed more often and feed more aggressively, and therefore their ability to act as vectors and to pass on dengue has been potentiated because of heat. So we notice if we compare between 1950 to 2020, the RO just speaks to the rate of the reproductive rate or the time it takes for infectivity to develop within mosquitoes. And this has been found to increase up to 33% between 1950 and 2020. So mosquitoes have become much more efficient and lethal. And we know dengue makes people ill. Again, there's lost productivity because there's time off from work. In some cases, people may get severe dengue hemorrhagic fever and may even result in death. So dengue can contribute also to premature mortality. And this in turn has implications for benefits, because we know in some settings, people are eligible to receive survivor's benefits, and that is a payout. And if people are ill, if people have died, the contributions have decreased. So you can see where there's this tenuous balance that occurs, and climate change is pushing the balance towards not being able to sustain our social protection systems unless we take action to integrate and think about how we can build resilience in the healthcare system, but also within our social protection systems as well. We want to look finally at food security in SIDS, because this is a concern, and for many reasons. We know that the heat waves, the droughts that we have been experiencing have contributed to that. So the higher frequency of heat wave days and drought months in 2022, for example, compared to 1981 to 2010, was associated with 2.6 million additional people who experienced moderate or severe food insecurity. Food insecurity has implications for personal health and well-being. It has implications for managing NCDs. It has implications for our ability to even, reach our sustainable development goals. And the downside of the food insecurity is that it pushes us to increase our importation, and most countries in the Caribbean are currently net food importers. And if we just look at this slide, it does show that over time, looking at the period 2012 to 2022, that there's been a gradual increase in the food import bill. And this is, the other side of the challenge that you have with climate change and health. So, well, health might be directly affected by ability to obtain healthy food that is considered to be nutritious and acceptable to the population. So these are some inherent definitions which go into the whole concept of food security. We know that when food is imported, a lot of the imports that come into our region are not necessarily the healthiest. A lot of them are ultra-processed foods, which we know can also then worsen people's ability to manage their chronic non-communicable diseases. So again, you can see a sort of a cycle where climate change will have direct impacts, but there are these downstream effects that can occur because of drought and lack of rain, what we import as well. So again, integrated solutions are required, because if we do import, we need to think about what are we importing, but certainly we need to think about how can we make our agriculture more resilient to support health. And as we speak about supporting health, there are conversations about this sort of agriculture that should be taking place. And, there's currently the thought that there's overconsumption of red meat and sugar. And the practices that are required to raise red meat and to grow sugar are actually thought to be contributing a lot to the carbon production. And actually 20% of deaths have been associated with overconsumption of high carbon producer industries. And on the other hand, there's underconsumption of fruits, vegetables, and whole grain, which does not leave as big a carbon footprint. So again, integrated policies where health is not just seen as the absence of disease, but how do we help people to attain lives that are useful, they can meet their developmental potential, they can enjoy healthy foods and so forth. So these are some of the things that are required, and it reminds us that health in all policies really underpins us being able to address some of these challenges. So there are many gaps, but I think there are even more opportunities. And, this webinar really sets the stage where we can explore some of the opportunities. And we can see within the whole social protection, climate change, and just transition dimensions that that this has now come to the forefront, where it is recognized that health, climate change, protecting people socially is important for us to be able to manage the response to climate change within our region. So there are key areas to increase resilience in both the health and the social security systems. So as we would have looked at over the past 15 minutes or so, climate change is inexorably linked to health, but these are also inexorably linked to social security systems, because as climate change impacts worsens, effects will worsen, and this is going to create more challenges for our social security systems. So the conversation is a timely one, because as climate change directly threatens people's lives, their incomes, their livelihoods, and health standards, it also places increasing demands on social security systems, which need to be responsive. I know when we started off, we were reminded that social security systems must be reliable, but they also must be responsive. And I think we need to be looking at it proactively. How do we strengthen our social security systems? How do we strengthen health? Because I think the two things need to work in tandem. So there's a counterbalance that is very, very important. So this is just some thoughts that I've had in terms of what may be the upcoming challenges. We see more acute and chronic climate-related health demands, has implications for our resources, our priority needs who are vulnerable. And there are many other things in health I didn't touch on all, but mental health, for example. There's also migration. Migration puts increased strain on the social security systems of the receiving country, but it also affects the country where people have left, because a lot of the times it is people who would ordinarily be in the productive sector. So social security systems are going to see increased demands, and we recognize that there are disparities in country capacity to respond to these demands. So there are a number of implications. But when we put the two together and looking in terms of an interconnected response, there are a number of key factors: sustainability of financing and insurance, and governance to ensure that things are done transparently and in a way that will redound to the best benefit of our populations. But also, we need to ultimately look at the structural and social determinants of health, because we know that people who are in poorer circumstances suffer the worst of the climate change brunt, but they're also the ones who benefit less from social protection. So there's a role for advocacy certainly a role for research, and to make our policies such that these factors are intertwined in the policies so that we're not operating in these silos to the extent that we have been, and of course, surveillance and monitoring to see what progress we're making. So I just want to thank you for your attention, and I'll be happy to discuss further within the comment section or the question and answer section. Thank you.
All right, thank you very much, Dr. Haywood. In the interest of time, I am sure that we will come back to you with a set of questions just about now, but I have the privilege of introducing a very dear friend and colleague, Mr. Shernell Thompson, who is the Deputy Director in the Research and Statistics and Data Analytics Department of the Eastern Caribbean Central Bank, where he leads the Financial Stability Unit and oversees a macro-prudential surveillance across commercial banks, credit unions, insurance in the sectors in the ECCU. With more than a decade of experience in central banking and policy analysis, he has coordinated the bank's flagship financial sustainability report and contributed to several publications. In addition to his policy work, he's also lectured in labor economics and economics of financial institutions at the University of the West Indies, Cave Hill campus. His research and professional work focuses on systemic risk and social security systems and is complemented by ongoing doctoral research on productivity and innovation in the Caribbean. The esteemed Shernell Thompson.
Well, thank you very much, David. I'll take esteemed while I can get it, but I very much appreciate your introduction. Good morning, everyone. It is a pleasure to be here with what I would say is quite a fantastic panel. And we've heard a lot so far on climate risks and social security and health. This morning, my presentation is going to focus specifically on this idea of sustainability under stress, climate risks, and the future of social security systems in the ECCU. Okay. In terms of the outline for the presentation, I'm just going to take a sort of a simple flow. We just evaluate some key messages, just some things that I want you to remember as I go through the presentation. We look basically at climate change and its impact, and then the fiscal experience of the ECCU economies. We look briefly at the role of social protection within the context of climate and climatic events, and then look at some of those climate-specific impacts on social security, and then consider the future social security systems in these years, some of the challenges that we may be experiencing, and some of the things that we can do to strengthen the social protection framework in light of some of these challenges. Now, in terms of the key messages, I just want you to remember, of course, that climate change is a significant threat to social security systems within the Caribbean and by extension the ECCU, and that the increased frequency of natural disasters, the additional economic damage, and the livelihood loss, there is some additional strain that is placed on social security systems which already have to contend with narrow funding bases and aging populations. Then the second idea is that climate disasters are actually increasing the fiscal burdens on governments. In particular, we see transfers and subsidies, including social assistance and pensions, increasing fairly rapidly in the ECCU, and typically around climate-related events. And then finally, we want to know that social protection is, of course, a critical tool for climate resilience, but a strategic approach is necessary to help reduce vulnerability of the systems themselves and to be able to respond to some of the economic shocks and support any adaptation measures that countries will be implementing. Now, in terms of climate change and its impacts, that has been expounded on a bit, especially by Dr. Haywood in the second presentation, but just to touch on some elements of it. we know, of course, that human activities are pushing temperatures up. So the global surface temperature has reached about 1.1 degrees Celsius above the 1850 to 1900 levels during that 2011 to 2020 period. And the shift in the climate is, of course, not only about warming, but it alludes to this increased variability and intensity of weather events. And I think we here in the Caribbean can definitely identify and point to the intensity of some of our natural disasters, specifically the hurricanes. Um, when we look at the data itself from the World Meteorological Organization, we see that there are just about 11,000 reported disasters attributed to weather and climate and water hazards, which has resulted in about 2 million deaths and about 3.6 trillion in economic losses. So certainly it's not just the magnitude of or the intensity of the disaster itself, but the economic losses that's associated with it. And then, of course, this has led to about 3.6 billion people being in areas or experiencing an increased vulnerability to climate change. And so the damages that we're seeing extend across most sectors, but they're particularly concentrated in agriculture and forestry, energy, and the tourism sectors. And so these individual livelihoods that are experiencing these disasters are, of course, affected through loss of homes, loss of income, and food insecurity in general. Now, when we look at climatic events in the Eastern Caribbean Currency Union, in particular, we've had a variety of experience as a monetary union. From Hurricane Ivan in 2004. I mean, we can go before that, but looking within the recent past, you see Hurricane Ivan in 2004 in Grenada should have cost about 147 million in damages, all the way up to Hurricane Beryl in Grenada, and which affected Grenada and St. Vincent and the Grenadines, which would have led to approximately between 230 million and 430 $1 million in damages. We've also seen and know of the experiences of Hurricane Maria, in particular in Dominica, which was approximately $186 million in damages. And what is not so important is not necessarily the dollar value costs. Yes, those are quite high, but when we place these values as percentages of GDP, we see how much damage is actually being created. So for example, we see with St. Vincent and the Grenadines, yes, it was about $230 million, but that amounted to only about 22% of GDP. When in comparison to Dominica, this would have been close to about 220% of GDP. So the magnitude of the effect is not just in the moment associated with the damage, but the country has to take time to recoup a lot of these losses and spend time in reconstruction phase. And of course, with the fiscal experience, you see, for example, Dominica, which would have experienced Tropical Storm Erika in 2015, and then Hurricane Maria in 2017. In as much as the disasters or the impact of natural disasters in the ECCU is somewhat heterogeneous, we do see that it does have a direct effect on the government's ability to balance their budget at the end of the year. We've seen it lead to widening fiscal deficits in some instances. And then we've seen the time that it takes for the country to actually recover on a whole. But the fiscal experiences are not just limited to the economic cost and the effect on the primary balances, but we also see that government's own transfer and subsidies have been increasing as they go to extend additional social assistance benefits, they adjust pensions, or they increase grants and other transfers to the general public or to businesses to support activities following natural disasters. And so we've seen a general uptick in transfers and subsidies for these various countries at a rate of about 6.2% since 2010. And we can definitely tie this to countries that have been dealing with natural disasters for a sustained period of time. We see St. Vincent and the Grenadines, for example. We see the experiences of St. Kitts and Nevis and St. Lucia as primary examples of those. And just for illustrative purposes, looking at the transfers and subsidies between Dominica and Antigua and Barbuda in and around natural disasters should give us a good sense of what has been occurring. Now, when we think about social security systems, the other thing that we need to keep in mind is that they are systemically important financial institutions, primarily because they're both highly interconnected with other financial institutions, specifically the banking system. In countries, in the case of the ECC, they are highly interconnected with the banking system, but they also tend to be major investors in domestic markets. And so where you have domestic capital markets, social security systems would form what you would call the institutional investors in domestic government markets, for example. So in the case of the regional government securities market for the Eastern Caribbean Currency Union, social security systems are one of the greatest investors and contributors and participants in that market. Looking at their connections with the broader financial system, we see, of course, that your social security contributions would drive the level of deposits within the bank financial system. And we see that tends to be activity or drawdowns against those deposits in and around major crisis type events. So for example, in 2017 and the year following, for the period between July 2017 and July 2018, when Maria and Irma would have struck Dominica in and around, I think, August, September, you will have seen that drawdown essentially begin and move into that 2017-2018 period that we're seeing here. The same thing has happened, of course, with
natural insurance themselves.
19, where we saw, for example, a significant drawdown of contributions and significant drawdown of social security contributions or social security deposits during the COVID-19 period. But also bearing in mind here that COVID was slightly different, where you did have, low labor contributions, so persons weren't really working. So this was also sort of an exception a little bit to the rule. Now, when we think of the role of social protection in the context of climatic events, social protection plays sort of four broad roles. One, it helps to reduce overall climate vulnerability. It aids in responding to climate shocks. It assists in compensating for the negative impact of climate change responses and guides the climate change adaptation and mitigation responses. In the first instance, when we say reducing overall climate vulnerability, what we're really speaking to is this idea of reducing poverty, promoting human development, and then supporting social equity through payments and cash transfers to vulnerable households. On the second point of responding to climate shocks, what we're really talking about is ensuring that household incomes are essentially maintained after a climate shock using these direct transfers or social insurance or labor schemes. And so if households are able to receive these transfers, they're not as susceptible to the shock itself compared to when they're not able to receive them. They'll be more susceptible and more likely to draw on additional resources, either from the government or from some other organization in order to sustain their livelihoods if they're able to at all. And of course, the negative social impact, socioeconomic impact associated with um, unemployment. Now, in terms of compensating for negative shocks, what this involves is essentially offsetting the negative effects of climate policy. And so when you have job losses that may be attached to things like higher energy prices, you may have the reallocation, for example, of carbon tax revenues, or the provision of unemployment benefits to assist in offsetting some of those negative impacts. And then finally, the presence of social protection can actually encourage behaviors or livelihood changes through those transfers and plus approaches with additional things like vocational training or public works. Right now, when we think about climate-specific impacts on social security, it moves just beyond, it moves to beyond the contributions, but what we're really considering here are challenges to their design, issues of funding and operational effectiveness of the social security systems themselves. And then these impacts, of course, further compounded by some of the difficulties that are existing within the ECCU. So again, with the climate-specific impacts, you're going to, of course, have increased vulnerability and poverty. We'll see higher demand for social security support, and of course, the responsiveness of some countries. So we have Angola, for example, when they would have been impacted by Hurricane Irma, the response was to introduce essentially what would be akin to unemployment benefits, and something that they're now looking at in terms of implementing in a more fulsome manner. Of course, there are other challenges that can occur on account of these climate-specific impacts. It can throw up flags related to the inadequate coverage and design of the social protection system itself, but it may also lead to targeting difficulties, because in some cases, the person affected by the climate shock can be the same person that is attached to a vulnerable household. And so there are some of these elements which, as we were thinking about the design and coverage of systems or the social protection framework to support persons within the Caribbean, but that we need to disentangle from the impacts themselves and the regular contributions that are being made. Now, when we look at the ECCU in particular, the sustainability of the social security systems themselves remains significantly challenged. One, social security systems within the ECCU are facing elements of an aging demographic. So our populations are getting older. We are seeing the impact now and not later. We because of our small populations on a per country basis, we do have a narrow contributory base, and that contributes to overall reduced worker productivity, depending on how you're measuring it. But with that narrow contributory base, we're also seeing attached to that sort of uneven economic growth. And that is also contributing it also functions as a second contributor to this reduced worker productivity. There's also the uneven pace of parametric reforms across the ECCU. There are some countries that are doing better than others in this regard, but this is an element of the social security systems development process that remains challenged within the ECCU. And of course, this is attached to some of the declining reserves that we've been seeing. So all of this is contributing to lower levels of reserves for the social security systems in the region. Now, in light of all the challenges that I've explained, how do we then manage or deal with or strengthen social protection and by extension the social security systems, considering the climate-related challenges and the broader sustainability challenges. Now, the ILO has some pretty good recommendations. One, looking at adaptive social protection. Two, considering a climate responsive social protection framework or shock responsive social protection framework. And then, of course, on the latter end, we can consider the pace of reforms within the region. An adaptive social protection is more rights-based and transformative in its approach, and it's really addressed that. It's really focused at addressing some of the root causes and vulnerabilities associated with social protection and poverty on a whole. The goal, of course, is to build this the absorptive capacities which are necessary for systemic change within the framework itself. When we think about climate responsive social protection, we are focusing on something that's a bit more growth oriented, but balances it against a more risk management perspective that uses a sort of a no regrets policies to scale up the safety nets that are in place. And then when we think about shock responsive social protection, the objective here is firstly to bridge the gap between humanitarian and development aid. And so what it does is that it enhances absorptive capacity by providing some of the immediate short-term relief for large-scale shocks. And of course, with the pace of reforms, once we've increased that, what we can then have is the stabilization of reserves within the social security systems in the region. We can see potentially increased compliance rates. We can see administrative expenditure, because here we're not just speaking about parametric reforms, there are also non-parametric reforms which can be considered. And we can then see improvements in investment income. So on a whole, of course, the sustainability of social security systems is at risk. Integrating social protection and climate risk is critical, but we can do this through a more strategic and a multifaceted approach. And we should move beyond some of the short-term fixes that we're seeing. But as we are considering these reforms, we must consider some of the climate risks which exist within that we have to face on an annual basis. And so with that, I'd like to thank you. I'd like to give special thanks to two of my colleagues, Mr. Yusuf Stafford and Mr. Gideon George, both economists within my department and at the central bank, who would have certainly contributed to in a very fulsome manner to the preparation of these slides and the notes for me this morning. So thank you very much for listening, and I remain available for any questions which you may have.
Thank you, Charnel. We do appreciate the presentation. As you were, this is now time for us to be able to ask questions of any of the panelists. And I do have a comment here going to Dr. Razavi, which is to say that I'm thanking you, Shara, for your excellent presentation. Her mention of the 3.3% of GDP required to bring social protection to an adequate level points directly to the webinar's main question: who pays? The standard answer to the question would be those companies or corporations causing the climate change. We know that there has been powerful resistance to that kind of call. What we face here is a clear case of injustice, and as she has mentioned, because of the matter of urgency, the 3.3% GDP would have to come from taxation and similar means of raising money required to deal with population problems. Having said this, we have to find ways of getting climate change culprits to actually contribute more to social protection. So thank you again. And that is coming from Professor Cal Theodore. Mr. Thompson, there's a question to you. Maybe our social security organizations have to lend their voice to the call for the fossil fuel companies, in particular, to make decent contribution to social protection needs of our countries. We can also give open support to calls being made by our own PM Motley and those companies to make greater contribution to the adaptation of needs of our countries. Question 1, Mr. Thompson. Social Security across the Caribbean have matured membership, ideal for communicating directly with its membership, that each individual can do to be more climate resilient personally by improving their health status. So what are the signs of danger? Overheating, dehydration, heat stroke at home, and what can we do, etc. There's quite a lot of information which can be communicated through Social Security, first to make them an online community. It's going to Mr. Thompson as well as Dr. Haywood. Any thoughts, Chanel? Given that you've spent quite a bit of time looking at impacts of hurricanes, and obviously we all know that those are heat related. And Dr. Haywood, with regards to how do we address the issues or communication issues with regards to overheating, dehydration among our very vulnerable populations.
Right, so I'd give it a start. Thank you. Thanks for the question, David. So just to clarify, your question is the one in the chat from Mr. Cumberbatch?
It is actually from
Professor Theodore?
Professor Theodore, yes.
Okay.
I see your hand as well,
Right.
Dr. Ravi.
Right. So certainly the social security organizations can lend their voice to the call for the call related to fossil fuel companies related to the consumption of fossil fuels. But I think the issue is a bit more delicate than that. If I were to consider it from strictly a financial sector perspective, we need to keep in mind one, where as it pertains to social security and fossil fuels and brown industries by extension, we need to keep in mind one, social security systems are national pension funds, so they are financial institutions by nature. Within that light, then they would need to deal with or manage their own investments in brown industries. So part of the call would be, in the first instance, to look at the type of investments that social security systems are making, ensure that the investments align with their own individual countries' NDCs, their nationally determined commitments, and see whether they can begin shaping their investment, their reserves, the investment of their reserves in a way that meets some of those green standards or those ESG standards that are established internationally and that they may establish for themselves. I think the second thing is we also need to consider that whilst we may not necessarily want or like the role that brown industries play, it's going to be very difficult in the near term to sort of remove them from the space, right? And so given that we're small open economies, unless our own green industries are well developed, we're going to find it difficult to not be able to deal with or interact with some of these brown industries. Now, as for them making a greater contribution to the adaptation needs of our countries, I think again, those can be done mainly through the NDC frameworks that the countries would have set up for themselves, as they're inviting some of these industries in to either do investment, whether it be to drill for natural gas or oil, or making any sort of investment in the country. We can then use our own frameworks as a guidepost to influence their ultimate contribution to our own adaptation needs. Again, it's a sort of a delicate conversation. I think there's an issue of what those climate taxonomy what they look like. As far as I'm aware, there isn't a cohesive climate taxonomy that's been implemented in the region by any central bank. And then we definitely need to consider, I think as a first step though, how we ourselves are investing our own reserves and where we're investing them. Are we investing them in oil companies, or can we invest them in other companies that still give us a suitable level of return against our own investment philosophy and framework, but allows us to have that credibility when we do open our mouths and do decide to lend our voices to the discussion. So I know that was a little bit long-winded, but that's my perspective on that matter. So it's a good question. Thank you.
Thank you, Chanel. Dr. Hayward, and then Dr. Razavi.
Yeah, thank you. So with respect to getting, I think the question was about how do we get these messages out to people as a
Great.
multi-level response in a sense. So the persons who have the information need to think about how to disseminate it. And this is one of the gaps that was identified even from the Lancet paper, that if we look at the publications coming out of the region, even though people might be researching this in various academic areas, whether it's public health, even economics, etc., we're not actually disseminating it even within academic circles. The other challenge, or the other area that should be focused on, is how do you make this easy, open communication for the average person to understand what climate change means? Because if people understand climate change is not just about the shrinking Arctic Circle, that's important, but understanding that at an individual level, it has implications for me if I'm a diabetic, if I'm a person living with diabetes, for example, or living with hypertension. So plain language messaging is important. And also recognizing that messaging, there's no one set message. I think in the past where health messaging has been at fault, or let's put it in a positive way, areas for improvement really relate to how we target messages. We need to learn a lot from people who advertise in the open market. Messages need to be targeted at particular segments of the market. So what may appeal to a younger person may not appeal to a middle-aged person, etc. And also thinking of the vehicles of the delivery. So, we need to leverage the online platforms more, even TikTok videos, but having and it comes down to also trying to rebuild trust with our communities, because unfortunately, because of COVID-19, a lot of the trust that existed between the health speak and what the population is receiving, that has to be rebuilt. But there's scope to do that. There's scope to work with NGOs and people who are already trusted community actors. So it may be a case of sharing this information with people who can also act as agents of dissemination within their communities. And to have, I would say, not just a single island, but we have agencies that work across islands like Healthy Caribbean Coalition, NCD Alliance, and so forth. So we could leverage a pan-Caribbean approach as well, but also recognizing that what marketers do, the messages are shifted ever so subtly so that you don't get that kind of, what's the word I want to say, become so acclimatized to seeing the same messages. So we need to think about how we make our messages refreshed and renewed, but it keeps the vitally important parts, but it also captures and maintains the interests of the population. So these are some of the things that we can think about.
Sorry, do you want to, I'll just come in very briefly in response to the question from Dr. Theodore. I mean, I think on this question of kind of more global solidarity and justice, I think we are at a low point, I can say that, in the multilateral system in terms of really being able to have measures that reflect that global solidarity and social justice, that really those who have kind of inflicted and contributed most to the climate crisis would take responsibility for repairing some of the damage by at least providing a better a global financial architecture for countries that are struggling to mobilize sufficient finance to meet that 3.3% of GDP additional investment in social protection systems. So I have to say I'm a little bit not very optimistic about the extent to which we can get the multilateral system to really put into action any sense of kind of doing good and trying to repair the damage that was done by those who contributed to the climate crisis. I think we should still try, and we should call on countries and companies and others who have contributed to the climate crisis to contribute to the reparation and to really facilitate resource mobilization by countries that are struggling to do so for their social protection systems. But in the meantime, I think also it's important at the national level to really try and put also into effect the idea of greater solidarity in financing. I think it's good that we have social protection systems that address poverty, that prevent poverty, that we have tax finance social assistance for those who are not able to contribute. But at the same time, I think it's really also important that we ensure that the financing mix does not rely too heavily on regressive forms of taxation, consumption taxes, VAT taxes, that we do have in place also more progressive forms of taxation to complement social security contributions. And I would say on the financing of social security as well, Mr. Thompson referred to the issue of sustainability of that financing. And I think in the context of population aging, in the context of very diverse labor markets, extending social security to workers in very diverse forms of employment is absolutely key. And really trying to bring what we call that missing middle. Many people who may be self-employed or in small enterprises with some contributory capacity and their employers to contribute is important. And I think, we need to have that financing mix of progressive taxation, social security contributions, and also not give up entirely, I would say, on the global context and multilateralism. The recently concluded agreement on a globally aligned minimum tax rate of 15% on multinational corporations. Although it has loopholes, it's not very high. It's still probably 15% is less than what many people pay in terms of taxation on their income. But it could still serve to retain, domestic resources in the countries where the firms are operating. And the world we know is awash with capital, with soaring stock markets, surge in private wealth. So the challenge is really to be able to tap into this potential source of finance. And I think there's also encouragingly growing support, including from ministries of finance of some of the major countries, for a minimum 2% wealth tax for billionaires. Although the details obviously still need to be worked out. But we have countries like Brazil and Spain that are championing these measures, also with the work on hopefully a UN framework convention on taxation, which will be discussed over the next few years and is one of the outcomes of the Financing for Development conference. So we need to keep some eye and some hope with the global multilateral system, but also I think a lot more probably can be done at the national level in ensuring greater solidarity, also in the resource mobilization and financing side, in addition to ensuring that social protection really has that universal reach, adequate benefits, and that it really does address both the climate and the life cycle risks that people face. Thank you.
All right, thank you, Dr. Wasavi. In the interest of time, I know there are other questions, but we have kept you for a good while this morning. I'll just hand over now to Dr. Valda Henry so that we can bring this morning's webinar to a close. Dr. Henry?
Thank you so much, David. Good morning, everyone. This has been a very stimulating discussion. I think we need to do a little roadshow with this because the different ideas that came together from the just transitioning that Dr. Rajavi brought in, to the health implication and climate change that Dr. Haywood brought in, and then Chanel came in terms of how do we respond to all the vulnerabilities that exist. We need to get that somewhere out. I guess it will be on our website. We have to share it on even in terms of the material. And I am just listening to that, and I look through the participant listing, and I saw some of the social securities there represented. I expected to see much more. So I think we have to package this and send it out to the social securities, package it and send it out to the ministries of health, to the ministries responsible for social security, and even in terms of the ministries responsible for justice. Because honestly, when we look at climate change and who pays, the point has been made by all of the presenters. We are the ones who pay. The ones who get impacted the most, who contribute least to the climate change, but impacted the most is the one who pays. And who pays? We paid from our own limited resources, thereby straining our countries and our institutions even more, as Chanel so rightly brought out in his presentations, in terms of the imbalances, in terms of the balance of trade, the widening fiscal gap, the longer term to pay this, and then the health implications. And Dr. Haywood, you were right on the money, because so often when we think about climate change, we don't tie it down to the health and then link it back to the impact on social protection. Because when you gave the information on the heat, I am telling you, yes, I know I'm talking about heat and how it impacts me, but I never stretch my mind to look at how it impacts our population across. And when that figures don't lie, and that is why evidence-based information is so important for policy framing. 3,000 more deaths for climate change. That itself was a startling revelation and how it impacts us. And then Dr. Rajiv started, but we can bring it all back to the implications that we saw. How do we ensure justice? Because ultimately, justice is key, because if we don't have justice, we don't have peace. And peace is critical for growth. Critical. And so we have to continue that dialogue. We have to, meet further. We have to get that information out. There were about 70-something of us online, 76 I saw at the highest number. Much more persons need to get it done. But I really want to thank you. So let me start with my formal thank you. So I want to start off thanking Mr. Reginald Thomas, the Deputy Chair of CCROSS, who stands in the breach for me on so many occasions. Reg, big thank you. And he stood in the breach for David this morning, I doing the little introduction, and we started off on time waiting. Well, we gave a few minutes. Then Patricia Edwards Westcott, who I'm telling you, that is the spine of the CCROSS committee. She keeps us on our toes. She keeps us reminded, as for me, to let me know that, hey, you have this responsibility. But Pat is just so efficient and effective. And then she stood in and did the opening. Welcoming Dr. Rajavi. Dr. Rajavi, let me tell you something about the free presenters. And they say I'm a hard marker. My students, I lecture. I consider myself, my vocation is to teach. And my students always said I was really tough when it came to giving them marks. But today, only A's. A's and A pluses I'm giving up, because honestly, you all did so much justice to that topic. I mean, it exceeded my expectations. So Dr. Rajavi, a big thank you. Climate change and that just transition. And I have downloaded the 2024-2026 report. So that's going to be part of my weekend reading. And I want to encourage all of us to so do. Dr. Heatherway Haywood, you brought that. I mean, I'm just thinking how I'm going to get you all on a little road show. I'm going to work on this. And you know how you brought that, you took all that information and brought it down. So again, you made reference to this Health Lancet report. I'm going to take a read. And I encourage us to do that, because what it does, it not only gives us information, it helps to broaden our own perspective of what is there. And then Mr. Chanel Thompson from my own ECCB, and who is our Social Security lead at the bank. Shans, you did well. Double thumbs up for you. And I really love, because when you start, so, you know, you had this slide on the challenges, and I took it in and I said, okay, I hope he's not stopping here. It has to move. And then when you came with the solution, and in fact, innovative solutions, you gave them nice fancy names: adaptive social protection, transformative social climate response, and so on. And what I see there is even ways for expanding that, greater collaborations into social securities as we move forward. Then my CCROSS Secretariat, who committed to the cause, committed to getting research on social security in the Caribbean done and out. And so we are working on a publication. And again, I invite all three of you to contribute, to consider contributing, to extend that material that you have presented today into a paper for publication. Because that information needs to really take wing, not just in the region, but beyond. So, CCROSS Secretariat, we have Professor Carl Fiedo, and all you know, Social Security in the Caribbean. When you talk about that, Professor Fiedo name comes right there. He was actually one of the examiners on my PhD defense, and he asked me the toughest of questions. And I said, if I couldn't defend, when I heard the question, I said, really now? See where it's coming from. I said, Walter, if you can't answer that, forget that. Just 3 years down the drain. Fortunately, I was able to answer it. Thank you, Professor Fieda, for that. Dr. Alpha Lafocard, again, working in the trenches for years, started off under Professor Carl, but has branched out and has taken HEU into new places and new direction, and who's really, I think, our force behind the CCROSS to get our research out. Christine Lapist, and of course, Pat, the two of them really work together in terms of coordinating. And so, and all of you participants, we thank you, because without you, it would not be there. I look across and I saw some of my friends on, because I sent it wide, and I'm really thankful you are there. So folks, in fact, Dr. Emily Dickford is on. And when I sent it to her, and she's like, oh, I would have loved to be a presenter. And I said, don't worry, Emily, you're already done for webinar number 3. Because what this webinar has done is really indicate and confirm that we have to do so much more work in terms of getting the message across. I looked at some of the comments that were made and said, how do we at Social Security work with the ministries and others to get the message across, even in terms of health, even in terms of the changes that we can make to enhance our health. And if we have enhanced health, what does that do? It strengthens the Social Security, because less demands will be made on it. And we know about NCDs and the cost of NCDs. And initially, people only looked at NCDs with the health implications. But NCDs has serious financial implications, which dovetails into social protection. And then truly, we have to get a way to get these people to pay. So I love what Dr. Rajiv said. Let us not so much look at regressive tax policies, but more progressive tax policies, so that those who contribute the most end up paying. So folks, it's Independence Day in St. Kitts. So for the Kittitians on board, I say happy 42nd Independence. Yesterday I was all decked out, so today I am slightly decked out here. as we celebrate our independence, the 42nd independence. And have yourselves a wonderfully blessed weekend. And until we meet again, let us continue working for justice. Let us continue working to advocate for the vulnerable ones in our society. Let us continue to work to strengthen our social protection pillars to help us to combat the climate change effects, which we know hits us disproportionately. Thank you and God bless.